Hello, my friends. Today we're talking in our newsletter about medication issues. There seems to be a cultural misunderstanding about medications in the elderly, and I continue to be really concerned about this. Polypharmacy of the elderly population can really cause a lot of serious side effects and issues. I would definitely talk to the primary care doctor about your medication list every time you go to the doctor and ask, do I really need to be on all these things? The reality is doctors don't like to discontinue medications that were prescribed by other physicians. And sometimes they don't have time to carefully look over everything for interactions. And as we get older, our bodies don't metabolize medications as easily as when we were in our 30s or 40s. So be very careful about this. More medications does not mean you're getting better care. It just means that these things are going to keep on adding up, and the more medications you're on, the more potential for interactions. And they can build up in your body over weeks or months, and you can have a sudden deterioration in some of your organs if you're being overly medicated. And they play a big role in cognitive deficits in the elderly too. So be very aware of what you're on, what it's for, how it interacts, if you really need to be on something, and always talk to all of your doctors about the possibility of cutting back. Even one less medication, if you're on over 5 medications, will make a big difference. Of course, you should never do this on your own without consulting your physicians, but it's always a good idea to check. Because a lot of times doctors are very aggressive with treatment, and they lose sight of the fact that the more doctors that are in the kitchen, so to speak, the more messy the soup gets. So talk to them today and be careful about your health and the chance of polypharmacy.